Hello everyone, this is Dr. Humanis welcoming you all in this series of how to approach. Today's topic is how to approach a patient with hematuria. Hematuria we call when there are 2 to 5 RBCs in hyperfield, but one test won't say its significance. To call it significant hematuria, what you do? It should be more than 3 RBCs on 3 occasions, or more than 100 RBCs, or gross hematuria. If one of these is present, only then we tell it is a significant hematuria. The causes of hematuria are the glomerular, non-glomerular. In glomerular causes glomerulonephritis, thin basement membrane disease. Non-glomerular in kidney, this pyelonephritis. Pyelonephritis can present with either microscopic or even gross hematuria. Renal cancer, polycystic kidneys, AV malformations, in ureter, stones, neoplasm, strictures, polyp in bladder, cystitis, and neoplasm. Other causes like VPH, exercise-induced menstrual bleed, DIC, anticoagulants if the patient is taking, bleeding diseases like thrombocytopenia. So now coming to the main topic, how to approach if hematuria. Okay, when the case comes, you have to see for if there are dysmorphic RBCs or RBC cast are present or not, and proteinuria. If that means the problem is glomerulus. There's some intrinsic problem. So in that case, what you do is serological hematological evaluation. What you do: blood cultures, anti-GBM antibodies, ANCA levels, complement levels, cryoglobulins, hepatitis B and C serological tests, VDRL, HIV, and ASLO, and to confirm your diagnosis, you do renal biopsy. But if this dysmorphic RBC is not present, RBC cast or there is no proteinuria, then next thing you will out is UTI. To see UTI, you check for pyuria and WBC cast. So if that is present, then you go for urine culture and urine eosinophils. If that is negative, the next test what we do is hemoglobin electrophoresis, urine cytology, urine analysis of family members to see any genetic causes, and you see 24 hours urine calcium and uric acid, because hypercalciuria and hyperuric aciduria causes what? Unexplained hematuria in children as well as in adults, and it is treatable by dietary changes. Okay. So even these tests are normal, then what you do is next is IV pyelogram and renal ultrasound. So to see any renal calculi is there, strictures are present, cysts or tumors, etc. So as indicated, you next you do is retrocal pyelogram or arteriogram or cyst aspiration, depends on what you get in this scan. But even that, if it's negative, then next thing you go is you have to see for CA bladder cancer is very common in old age people and adults. So if old age person is presented with gross painless hematuria, you have to suspect for CA bladder. And if something comes out in cystoscopy, you go for unigenital biopsy and evaluation of that. And if even cystoscopy comes out to be normal, then you do is renal CT scan to show any masses or anything, and do the renal biopsy of the mass or lesion, whatever you find. Now, if even after all these tests nothing significant you found out, what you do is then follow up periodic urine analysis. Thank you.